What is stroke? A stroke occurs when blood flow to a part of the brain stops. A stroke is sometimes called a brain attack. A stroke can also occur if a blood vessel inside the brain bursts, leading to bleeding inside the head. There are two major types of stroke: ischemic stroke, hemorrhagic stroke. Ischemic stroke occurs when a blood vessel that supplies blood to the brain is blocked by a blood clot. A hemorrhagic stroke occurs when a blood vessel in part of the brain becomes weak and bursts open. This causes blood to leak into the brain. High blood pressure is the main risk factor for strokes. Other major risk factors are irregular heartbeat, called atrial fibrillation diabetes, family history of stroke, being high cholesterol, and senging age, especially after age 55. Stroke risk is also higher in people who have heart disease or poor blood flow in their legs caused by narrowed arteries, people who have unhealthy lifestyle habits such as smoking, excessive use of alcohol, use recreational drugs, a high-fat diet, or lack of exercise, people who have a hereditary tendency to develop blood clots, women who are pregnant have an increased risk while pregnant, women who take hormone replacement therapy. Symptoms. Symptoms of stroke depend on which part of the brain is damaged. In some cases, a person may not know that a stroke has occurred. Symptoms may occur on and off for the first day or two. Symptoms are usually most severe when the stroke first happens, but they may slowly get worse. A headache may occur if the stroke is caused by bleeding in the brain. The headache starts suddenly and may be severe. May be worse when you are lying flat, wakes you up from sleep, gets worse when you change positions or when you bend, strain, or cough. Change in alertness, changes in hearing or taste. Changes that affect touch and the ability to feel pain, pressure, or different temperatures. Confusion or loss of memory, problems swallowing. Problems writing or reading, dizziness or abnormal feeling of movement. Lack of control over the bladder or bowels. Loss of balance or coordination, or trouble walking, muscle weakness in the face, arm, or leg, usually just on one side. Numbness or tingling on one side of the body. Personality, mood, or emotional changes, trouble speaking or understanding others.